Clinical behavior analysis addresses socially significant problems, viewing the thoughts, feelings, and actions of clients to be behaviors, and considers the ultimate causes of behavior to be in the environment of the individual. The interventions are mostly verbally based. It is a relatively small field within ABA, Applied Behavior Analysis. In 2024, the Behavior Analyst Certification Board reported that just over 4% of board-certified behavior analysts, BCBAs, identify clinical behavior analysis as their primary area of professional emphasis. Clinical behavior analysis uses evidence-based methods to understand and change human behavior effectively. The field originated from behaviorism, focusing on observable behavior and its functional relationships. It has evolved by incorporating applied research into practical clinical treatments. Clinical behavior analysis, referred to as CBA, is a subspecialty of ABA that employs behavior change strategies to address a wide range of behaviors to help individuals achieve a higher quality of life. The Behavior Analyst Certification Board explains in its 2023 description of practice subspecialties that clinical behavior analysis is the application of the conceptual and methodological tools of behavior analysis to treat problems that have traditionally been characterized as mental disorders. The list of issues that CBA addresses includes stress, depression, anxiety, impulsivity, inattention, grief, relationship discord, substance misuse, disruptive behavior, hoarding, and many more. Although there are many similarities between CBA and other mental and behavioral health modalities, it is distinct and firmly rooted in the practice of applied behavior analysis. It combines basic behavioral science with clinical applications for accurate treatment outcomes. Clinical behavior analysis prioritizes identifying the function of behavior to understand it and to find appropriate behavior alternatives. It develops tailored intervention plans to meet individual client needs effectively. Most practitioners of CBA focus on adolescent and adult populations. They may treat individuals without any disabilities, as well as individuals with mild to moderate disabilities. Typically, the individuals receiving treatment are called clients unless they are being treated as a part of a multidisciplinary team. Then they might be referred to as patients. There are a lot of different practice settings for practitioners of clinical behavior analysis. They include private practice, substance abuse clinics, eating disorder clinics, weight management programs, student services departments, governmental agencies, hospital and medical clinics, and higher education institutions. There are a wide range of behavior analytic approaches that are used within CBA. Some of the more common approaches that are implemented are goal setting, skills acquisition interventions, self-management strategies, rule-governed behavior, environmental interventions, pro-social skills training, acceptance and commitment training, or ACT, community reinforcement approach, CRA, independent living skills training, and integrative behavioral couples therapy, IBCT. Behavior analysts who practice CBA need to be competent in the fundamental skills of ABA. Some of the key fundamental skills that are frequently employed in CBA are writing operational definitions, articulating social validity of treatments, obtaining consent and assent, identifying behavioral deficits, identifying appropriate replacement behaviors, collecting, graphing, and interpreting data on antecedents, behaviors, and consequences, and determining appropriate reinforcement and schedules of delivery of reinforcers. As in all of the subspecialties of applied behavior analysis, clinical behavior analysis analyzes the functions of specific behaviors. It begins by identifying antecedents, recognizing those events or triggers that precede behaviors. And then it analyzes the consequences to understand the outcomes or reactions that maintain or reinforce those behaviors. Then, using assessment results, it designs tailored interventions targeting the specific functions of behavior. Both reinforcement and contingency management are fundamental tools in clinical behavior analysis for modifying behaviors. Reinforcement is used to increase the likelihood of desired behaviors by providing positive or negative consequences. Contingency management involves systematically arranging consequences based on specific behaviors to encourage change. Clinical behavior analysis leans heavily into a couple of the behavior modification strategies that we learn as behavior analysts, including shaping. And shaping involves reinforcing successive approximations to encourage a target behavior gradually over in time. So it means that we're helping people shape their behaviors and skills so they get better and better until they've reached that level of mastery. Then we also rely heavily on chaining techniques, and chaining links individual behaviors into a complex sequence to achieve a desired outcome. So teaching all of the different phases and steps of a skill and then linking them together so a more complex behavior, a more complex skill is learned and mastered. Both of those are very important in clinical behavior analysis. Clinical behavior analysis can be well integrated with other therapeutic approaches. It is often practiced in collaboration with other care professionals as a part of multidisciplinary teams. This can contribute to a holistic care approach, ensuring that individuals receive comprehensive care that addresses psychological and behavioral health needs. Behavior analysts may work in teams closely with medical personnel, psychologists, and psychiatrists to align interventions effectively. Behavior analysts who practice clinical behavior analysis must consider important ethical and legal requirements and limitations. They must ensure that they are limiting their practice to behavior analytic interventions. They must also ensure that they have the training, experience, and supervision to provide clinical behavior analytic services and interventions and are practicing within the scope of their competence. They must also be aware of and follow licensure limitations within the jurisdiction where they practice. In some cases, additional certifications, qualifications, or licensure is required to treat certain behaviors. Clinical behavior analysis is an advanced practice of ABA. It often requires additional training and mentorship beyond board certification. Practitioners are frequently co-qualified in other modalities or practices. Behavior analysts who provide additional non-behavior analytic services under other qualifications must clearly distinguish those services by following the directions in the Code of Ethics under item 5.06. Practitioners of CBA often attend trainings or utilize resources created for use in multiple mental health and care fields. It is the responsibility of the behavior analyst to discern and utilize only the interventions and strategies consistent with behavior analysis. For those who work within the field of clinical behavior analysis, it is important to stay connected to the research and the community of practitioners, and one of the ways that you can do that is through the important resource of the Association for Contextual Behavioral Science. They have a clinical special interest group, a SIG, that you can join, and that has a Facebook page, and you can interact with people in that way, and there's resources and information and events that they'll share with you. And they also have a journal of contextual behavioral science that you can check out. It has research and articles, and it's an important resource for those people who are practicing within clinical behavior analysis. For supervised unrestricted fieldwork, you can review the BACB fact sheet on clinical behavior, or you can go to contextualscience.org and you can access the Journal of Contextual Behavior Science, which is the official journal of the Association for Contextual Behavior Science. And they make your first issue free for the public, so even if you're not a member, you can access an issue. And then after you have a chance to review that issue, take some time to look it over, and the fact sheet, make some notes that we can discuss in an upcoming supervision meeting.